The following is a conversation. It has the features of any conversation, such as imperfectly expressed thoughts, ill-considered opinions, and the notions of several sleep-deprived brains. Try not to get your stethoscope in a twist about it.
Should I call you guys physician associates, assistant physicians, or physician assistants today?
I don't know if we've even earned those titles yet. I think we're still considered students.
Not you, but your profession.
Maybe.
I think they...
But thank you for being pedantic about it.
They did. The name change is official.
Is it official?
I think it's in the process of getting
Yeah, I think the AAPA is now the American Association of Physician Associates, but it's not official when it comes to like everyday practice, like in the hospital or in the clinic. So you can maybe
we should start that.
Yeah, either one's fine. I mean, assistant
or just PA.
Yeah, PA works. PA is good.
To be clear, it doesn't much matter what you answer because I would have accidentally called you physician assistants no matter what. I have literally 53 years brain training to overcome, but
yeah,
and my brain's not flexible enough to handle that.
Meandering in the margins of medicine, it's the Shortcoat Podcast.
Weird news,
fresh views,
helpful clues, and interviews.
By students, for students.
Subscribe to our weekly show at theshortcoat.com.
Welcome back to the Shortcoat Podcast. This is a show that gives you an inside look at medical school from the students drinking from that fire hose. It's a production of the University of Iowa Carver College of Medicine. I'm Dave Etler. With me today in the SCP studio, a bunch of PA1s. He's Arvada West High's best and brightest, all the way from Colorado. It's Noah Vasquez.
Thank you for having me.
Is that not your high school?
It is. I was a little shocked that you pulled that. I'm like, I haven't told anyone about that, so that was a little alarming, but
it's all in my little secret database of students.
Who knew?
Yeah.
I have access to literally no other information about PAs other than your hometown and your high school for some reason.
Why? Yeah, why high school?
I don't know. It's just, it must have come from whatever your equivalent of AMCAS for applying to schools.
Shout out A West, man. Represent.
Yeah.
There you go.
From Wellman, Iowa, it's Mid Prairie High School's own Golden Hawk, Olivia Quinby.
Hello, happy to be here.
Iowa's Indianola High School, where 98% of students graduate, never gave us a better human being. It's Emily Sarvis.
That's what I'm talking about. Thank you so much.
And he's a Pulaski High School Raider through and through, drinking a great big glass of Wisconsin's official state drink, milk. I'm going to try that again. He's Pulaski High School Raider. Shit.
I didn't go to Pulaski High School.
That's not what my database says. Okay. He's a Pulaski High School Red Raider through and through, drinking a great big glass of Wisconsin's official state drink, milk. It's Noah Herkert.
Yeah, thank you for having me. I actually went to Verona High School, the Verona Wildcats. I have no idea where.
No, you went to Pulaski.
I can go to Pulaski. Yeah, I can go to Pulaski if we need us to.
I was also Wildcats. That's kind of wild.
We're all in this together, man.
Yeah. Oh yeah.
Willie the Wildcat.
I don't even think we had a name for ours. I could be wrong.
It might have been Pulaski who had.
It could have been
Willie the Wildcat or whatever.
So is that skim milk or whole milk? What would you have?
So skim.
Yes.
For me.
All right. Just had to make sure.
But for Wisconsin.
But for Wisconsin,
whole milk.
Okay.
Yeah.
All right.
You might not even pasteurize it.
Heavy.
Depends where
Hardcore.
Heavy cream, I think. For for Wisconsin. Well, welcome to the show, especially newbies. Before we start today, though, I want to tell you about an awesome opportunity to learn more about healthcare careers at the University of Iowa Carver College of Medicine. On October 5th at 4 p.m., we will be hosting a free virtual conference where you can explore 3 of our top programs: the Biomedical Science PhD program, the MD program, and the Physician Assistant program. So you'll get an inside look at each program directly from faculty, students, and admission staff. If you're exploring healthcare careers, this is your chance to get all your questions answered, and registration is totally free. Registration closes on October 2nd. So yeah, we have enough time. It's on October 2nd. So register now to reserve your spot. This you definitely don't want to miss. Go to theshortcoat.com/to register and join us there. So that'll be fun. You can learn a thing or two. Speaking of PAs, when this show comes out, it's PA week.
Woo!
Big deal.
A whole week. And to put that into perspective, I as a father get one day.
It's true.
That's bullshit right there. This is the week when all of healthcare joins hands in celebrating their 140,910 physician assistant colleagues, members of a profession that started in the 1960s and has since evolved into a cornerstone of modern medical teams. PAs bring a blend of expertise, flexibility, and holistic care that's hard to match. And today's episode is a shout out to all the PAs out there, which is why we have a bunch of them here today to talk about it. Right, Noah?
Yep. Represent.
Yeah.
Pretty much what I thought we could kind of dive into is how all of us in this room ended up coming to this school. Like, how did we get here? What was that journey like?
How did you so come to the school, and also how did you select PA?
Definitely.
A bigger question.
Yeah.
So I'll go first then, if that's cool. So I started out really not sure what direction to go with in life. I like science. I like thinking about things. I like problem solving.
You came out of the womb not knowing what your direction in life is.
Yeah,
crazy.
hard decision.
Huh.
I originally wanted to be an engineer, and then I saw my brother going through engineering school, and I saw him doing Calc 4, and it said, "Nope, not for me. I don't want that."
I didn't even know that existed.
Calc 4.
You don't want to know what they do with Calc 4. It's like Vegas.
I don't know anything about calculus.
About
what I know about calculus is that for some reason, when I was in college, my academic advisor insisted that I had to take calculus, and gave it a shot, and I did not do well. And
It's
also,
hard.
It seems to me the hard way to do things that you already know how to do.
Yeah.
Yep.
Yeah.
And you use it every day.
All the time. Integration.
Driving
Don't get me
and-
talking about derivatives. Yeah. But I went to the doctor's office one point, didn't get my doc, got a PA instead. And we got talking and everything, and I really liked that kind of patient interaction. So I was like, this is what we're doing. Did pre-med.
How old were you at that point?
No. 16, 17?
High school, yeah.
Something like that. And they still had me take calculus. So you heard it here. You don't need calculus to be a PA. So if that changes any minds.
You're not done with PA school yet. You don't know.
That's a good point. That is a very good point.
Curriculum changes.
But it wasn't a prereq to get here.
Oh, okay. Well,
Yeah, thankfully.
Just the first one, not 4 though.
Yeah, thankfully. But did pre-med, all that kind of fun stuff. My big story, I think, was getting my service hours. I had the idea of, with a couple of my friends, we were going to be CNAs, and went through the whole school. We found this accelerated program in Phoenix, Arizona, that you did a whole PA certification in, I think, 3 weeks? A month, something like that.
PA or CNA?
CNA, sorry. CNA. Did I say PA?
This just
Yeah,
you can be a PA.
In 3 weeks. Yeah, no. A CNA certification. We were in class, I believe, 8 to 8 every day. And it was awful. And it was just so much information so quickly. We got into clinical rotations, and I was like, this is hard. This is hard stuff. Got the certification, got out, and I started looking for jobs, and it was just like, yeah, this isn't my speed. I'll look for something else. And ended up being a phlebotomist. And I got to tell you, being able to stab people for your job isn't all like the worst thing in the world.
I have fantasized.
See, yeah, that's the nice thing.
Now, look, I don't think we can endorse that.
No, we're not endorsing that. You're always nice to your patients, but it's just it was a very cool job. Got to see a different side of medicine, and I'd highly recommend it to anyone. I got to be an outpatient side, inpatient side. I got to go to different floors, different hospitals, different locations. I've worked with all kinds of people because you see them for like 5, maybe 10 minutes at a time. So in a day, you'd see 30, 40 people. The most I've ever done one day was 80, and it's like you're interacting with all these people again and again and again. So you learn how to talk to people, you learn what is good working with people, what isn't, and it was a really eye-opening experience, and that helped me kind of get here, I think, a little bit, because I think we only have 2 other phlebotomists in our class. I think Will and someone else. So it kind of stands out, give you a different perspective, and
cool.
Got me here, I think. Yeah.
Plus, phlebotomist.
Which up until...
Love that word.
I think up until I was a phlebotomist for 3 years. I think up until about 6 months ago, or maybe a year ago, my brother thought, he's an engineer. I need you guys to know this. He's an engineer.
Calc 4.
Exactly. But apparently it doesn't help you spell, because he thought phlebotomist started with an F.
Yeah.
And so he would call me an F whenever
engineers. I don't know if engineers are the greatest spellers.
I mean, English is just a complicated
I don't
language.
think
we
can
can
spell that
I can't spell either, but
Something in lecture every single day. Just it absolutely boggles my mind how it's spelled.
Don't look at my notes. Don't look at my notes. That's all I say.
I'm a big proponent of you like trade one skill for another. So I think like to get as good at math as they do, they have to trade something.
Sure. And that's what spell check's for. Yeah.
I would rather than be good at math.
Yeah.
Yeah.
Grammarly exists for a reason.
Bingo.
Grammarly is my best friend.
Yes. You should get on that.
We need to talk, you and me, about Grammarly. Anyway, in a good way. I want to know more. What about you, Emily?
Yeah, so my story is kind of long, but I started off college kind of knowing that I wanted to be in the science realm. Started out as a biochem major, did some research, found out that was not for me. Knew I kind of loved genetics, planned on being a double major, and wanted to become a genetic counselor. Have a huge respect for the field, shadowed a cancer genetic counselor, and realized, there's a lot of sitting behind a desk, looking at a lot of data, and sometimes delivering some pretty hard news. And, the world of medicine is kind of, cohesive in that regard that we don't always get to deliver the best of news. But I kind of looked at that and I was like, I need to do things that are more hands-on. And speaking of phlebotomists and blood and all that kind of stuff, I didn't want to go into hands-on medicine because I thought I was afraid of blood. So I realized I wanted to do it. Force myself to go into a blood drive and get desensitized to
bad call.
Blood drives.
Bad call.
Ended up working out well for me.
All right.
Why did you think you were afraid of blood?
I would pass out after every blood draw of my own, getting any sort of vaccination, anything like that. Like I would pass out at the clinic.
It was just your own blood you had a problem with.
Yeah, it was just my own. I figured that out, kind of moved on, had a freak out moment of I don't know what I want to do with my career, and learned about a route and kind of went on from there. And I became a CNA for my patient care experiences, and I was on the med-surg unit helping patients before and after procedures, and that can be a very stressful time for them. And then was also on the primary COVID unit as we transitioned during the pandemic, and gave me a huge respect for the amount of interprofessional work that has to go into handling really, really tough times. And I kind of solidified in my head that the PA route was for me, because I think, while we've gained a lot of more autonomy through some recent legal changes, which I'm sure we'll get into, we this role was formed to kind of bridge the gap in provider shortages. So being able to advocate for our patients and to just build up our team better to give them the best care possible. So it kind of seemed like a no-brainer at that point.
Nice, man. Nice.
Yeah.
Noah?
I didn't start out wanting to be PA. When I went into college, I had no idea what a PA was. I didn't even know that it was a healthcare career. I was pretty dead set on being an MD, being a doctor. So I went through 4 years of undergrad, did all the pre-MD stuff. I actually took the MCAT, applied to med school 2 separate times. Didn't get any interviews or anything like that during med school. I applied to 7 PhD programs for neuroscience because that's what my undergrad was in. Didn't get into any of those. So I was kind of at a point where, kind of similar to what Emily was saying, I was like, I don't know what I want to do with my career. And then I had a friend who ended up going to PA school out in Colorado who was like, you should take a look at potentially doing the PA route. Started to learn a little bit more about the profession. Learned that I had a lot of work to do to get the prereqs for PA school because they're a lot different than med school. So I did my patient care experience. I worked at the University Hospital in Wisconsin, UW-Madison. I was an EKG technician. So I just did a lot of EKGs, heart monitor placements, stress testing, things like that. And while I was doing that, I was really fortunate, similar to how Noah was saying, I got to go around to every different unit because everyone needs EKGs, heart tests, things like that. So I worked with adults, inpatient, outpatient, peds, inpatient, outpatient. We had a Department of Corrections unit, so I worked with the DOC patients as well. And kind of through all those interactions, I was more exposed to the PA profession, and I started to kind of see that they got to fulfill a lot of the things that I liked about being a doctor while also not having a lot of the things that I didn't like about being a doctor. So They got to be in that provider role. but they also got to be a little bit more present in their personal lives, and they weren't the number one most counted on person. They could kind of defer and be a little bit more collaborative, in my opinion. So I ended up taking all of the prereq courses over a summer, did my 1.5 years of clinical experiences, and then applied to a bunch of different PA schools and ended up coming to Iowa.
Here you are.
Yeah.
What about you, Olivia?
My story starts when I was 6 years old. My dad was actually in a severe accident and became paralyzed from the waist down. And at a very young age, I saw his healthcare team work together very collaboratively to help him recover from his accident and work in rehab to gain up to 99% independence, which is very impressive for an individual to gain back that much independence after what he went through. And throughout like middle school and high school, he was in and out of like long-term care for like skilled assistance. He kept having additional health issues happen. And when he was like chatting to me about it, I'm like, okay, like I see that there's a need for more healthcare workers and providers. So all of his experiences leading up to that point, like I really think I need to go into medicine. I really want to change the more so negative things that he's talked to me about from his perspective. And the lack of providers really helped me think about like, how can I help close this gap? And so I learned about the PA profession a little bit earlier compared to others, just because of my dad's experience. And my high school, shout out to Mid Prairie in Wellman, Iowa, actually offered a CNA class through Kirkwood Community College here. And so I got my CNA my junior year of high school, started working in a long-term care facility in Kelowna, Iowa. So I started accumulating my hours very, very quickly. And I would work during like summer breaks, holiday breaks, as much as I could. And exploring different professions throughout undergrad. I thought about pre-med for a while, like doing the MD route. At one point I took a step back, like, do I even want to do pharmacy? Do I want to do do I need to change my major and do nursing? I kept thinking about it, but the collaborative part of the PA profession is what really kept me locked in. And it's what I'm most excited about once we graduate and finally get that C instead of an S.
Yes.
After PA, no more PAS, PAC, please.
Never been so excited about getting a C.
Yeah. Oh, hey,
yes.
bingo.
100%.
And so it's definitely very different for me compared to your guys' stories, but I think it goes to show that any time in your life, like that one exposure of like healthcare and medicine, for me it was a little bit more of a traumatic event, but I was able to take that event from my early life and kind of change it into something positive and really see how I can make a difference in our community.
Love that.
Thank you.
That's huge.
Tell me a little bit about what it took to get into PA school.
Oof. I mean,
wow.
Because
it's a heavy question.
Yeah.
Lots
A whole other
and
segment
lots
on that.
things.
I mean, because I am more well versed in what it takes to get into med school.
Yeah.
And it's just there's actually more to it, I think, for PA.
There's a lot.
Yeah.
The patient care experience is one of the big differences. Most PA programs across the country have required a number of hours that you have to have direct hands-on patient care. So that's not like working as like a unit coordinator or something. It's like you have to be either like a CNA or a phlebotomist or like an EKG tech or someone who is going, or like an ER tech, someone who's going to be actually doing hands-on care. And I think that's probably the biggest difference. I think you guys would all agree between MD and
a few like prereqs are a little
classes.
different,
Yeah,
but
like
that's probably the big one.
Microbiology. I don't know if that's required for MD students, but that's a prereq. I think stats. I don't know if it's required.
We also learned about anatomy being a requirement for PAs, but not necessarily a requirement for MDs, which was kind of an interesting difference. But yeah.
One thing to note, like I said, I applied to both MD and PA. One of the things that is very different is the standardization of the MD admissions process.
I was going to ask you about that.
It's much more uniform. So most of the schools, it's still not perfect, but from my experience, most of the MD schools have a more solidified list, and it's shared between shared between most of them. Whereas,
so you can learn one.
Yeah, exactly. So you take the same 8 classes, and you'll be able to apply to most the MD schools. Whereas every PA school, it seems, is different, and every hour requirement is different. And some schools will require you to have 3 psych classes. You have to take medical terminology. Some don't require anything. Some you need the GRE. Some you don't. Some you have to have either the GRE or PA CAT. Some don't.
Or the Casper.
Yeah, the Casper, exactly.
Yeah, that's a new requirement.
Good old Casper. Casper is the test that it's are you cool enough to be in medicine?
Are you a good person?
Yeah,
and then they give you a percentage or a quarter, a quarterly percentage at the end, and they're like, you are 55 to 75% a good person.
Ooh, I actually did really bad on that.
Yeah, I did too, because I think it's compared to the entire people that take it.
Yeah.
It's not a standardized score; it's in relation to everyone else.
It's very subjective.
Feels weird.
Yeah.
Also, we talked about this on a show years ago, so I don't know if it's changed, but my understanding was that was not a validated tool at the time. So.
Well, I think I'm a great person, and I got the bottom percentile.
I'd say you're a good person.
I would agree.
I got mid percentile, and I said,
you seem all right.
I firmly believe after taking it, I've taken it 3 times, and I didn't do great the first time, and then I studied, in air quotes, for it the second 2 times, and I got the highest percentile. So
you studied how to be a good person.
Yeah.
Can you walk us through that?
Yeah.
Yeah. There's basically a set list of when you respond. In my opinion, this is my opinion, not the views of anyone else at the Carver College of Medicine. Just Noah as a PA student.
That Noah.
Herkert.
His disclosure.
That Noah, not this Noah.
Wisconsin Noah.
Wisconsin Noah. That is my disclosure. I think that it's basically a test that you can study for, and you can get the highest percentile if you know what they're looking for out of their answers.
And that's what's tricky about the whole application process. You kind of have to learn how to play a game a little bit.
Yeah.
Yes.
And this is true for all kinds of applications.
Yep.
This is not just true for, you're going to do this again when you look for jobs. You're going to play the game.
Mm-hmm. Yeah.
And, okay.
I applied to 16 schools.
That's
when
a
doing
lot.
this.
I would say, I applied to 13.
I did. I applied the year before this, kind of as a happenstance. It's we'll give it a go, see what happens. Don't do that. Spent a lot of money on it, went nowhere. And so this year was I'm getting into PA school. So I did not have a summer. It kind of lined up to where I had COVID at the same time. So it's not like I could do anything else. But I think all in all, with all fees involved, with all extra classes taken, with everything all said and done for the application process, I think it was about $3 or $4 grand into it. Just paying for everything. It is not a cheap application.
No.
It is, but you don't have to apply to 16 schools. You don't have to do that, but it is a commitment, and I did not recognize that first go around.
Make sure you know what schools you're applying to require what.
Yes.
And which schools you want to get into. Don't do what I did and take 5 classes the summer before you're going to go to PA school, and then end up going to the school that didn't require any of the 5 classes that you took. So you pay $5 grand in tuition for nothing.
Yeah.
I feel like it would be easy. Yeah. It would be easy to screw that up.
Yeah.
I'm going to give you a pass. No.
Thank you.
Thank you.
Yeah.
Not you. You get no passes.
So I applied to 10 different schools, and I kind of played the game of, okay, maybe they're going to try and select people more regionally. So I did 5 Midwest, and then I said, maybe I'll give the chance of, maybe they don't want somebody for their region and they want to diversify the location of their students. And so I applied to 5 all over the rest of the nation, and really looked at their stats in terms of their class size, in terms of their scores, in terms of their hours. And you can really go down a rabbit hole with that. And I will say, those ranges and those things are, they mean so little. I think truthfully, once you get into the interview process, because they basically see, okay, you met our standard requirement and you're kind of falling into the region that we want you to be at. But I know, at least for here and for a lot of the schools that I interviewed at, they didn't even ask about the application. They didn't ask about, so you did these many hours in this spot and blah, 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 blah. But it's, okay, what did you gain from that? How can you apply some of the lessons that you've learned from this experience into a randomized situation that they give you in an interview, which can often be really interesting and quite unique on on interview day. So
do you have a story for us, Noah, about that?
I do. So for anyone that's listening that is pre-PA or pre-MD or pre-anything where there's an interview, just go into your interviews with an open mind, be prepared. I had an interview at a school, which I won't name, but I was in a group interview, and it was me and 4 other applicants, and our task was we were supposed to imagine the situation in which we were a board group for a burrito company, and terrorists had infected the bean supply chain with radioactive beans.
Not the beans.
Not the beans.
Oh, no.
And together we had 20 minutes as a group of 5 who had never met before to come up with a presentation to give to our shareholders, customers, and employees. And then we had to give that presentation to the panel who was judging us for our interview. So, like she was saying, sometimes they may ask you a question about your one experience, but a lot of times it's going to be stuff where they're trying to get at something a little deeper than just what's on your application.
Well, I guess it makes sense. You're the whole thing of PAs is it's a collaborative environment to work in. 100%. And so I guess that's what they're doing. I love this task. I would hate it if I was involved with it, but it's pretty good.
It was my first PA school interview too, so I remember I was really stressed out and nervous, and I remember hearing the prompt and kind of it took the edge off a lot of being like, oh, they just want to see us interact as human beings, because that's what you're going to do on your job. So
yeah. Throw yourself on the pile of beans as though it was a grenade.
Final answer.
Hey, Shortcoats, it's me, Dave, your Shortcoat podcast host here. And you do not want to miss the event I'm about to share with you. If you're still exploring careers in healthcare, I'm going to tell you about an awesome opportunity to learn more about the possibilities at the University of Iowa Carver College of Medicine. On October 5th, 4 p.m., we'll be hosting a free virtual conference where you can explore 3 of our top programs: the Biomedical Science PhD program, the MD program, and the Physician Assistant program. You'll get an inside look at each program directly from faculty, students, and staff. This is your chance to get all your questions answered. Obviously, registration is totally free. Registration closes on October 2nd, so register now to reserve your spot. Go ahead and hit the link, and we'll see you there.
What do PAs do? Anyway, I mean, we've talked a little bit about the collaborative aspect of it, but what's the difference between PAs and MDs?
What did Tony say?
Yeah, well, we could hear from a clip from Dr. Brenneman.
Yeah,
Professor Brenneman, who is the assistant director.
He's program director.
Program director
PA
of our PA program here. Let's hear from Professor Brenneman.
These are clinicians that provide all care to patients, sometimes in specialties, sometimes in general medicine, depending on what route the PA does after they graduate. And they are really somebody that can help expand healthcare to all of our patients. They can do most of what a physician can do. What I like to say in general medicine is that we do about 90% of what the practicing physician does, and that 10% often needs to be referred on to a specialist in another area. So that's pretty much how that works, I think, out in the general clinical area. And in specialty, much the same. In their area of practice, once they have had a period of time under their license and practice, they get to that point where they are about 90% completely independent.
So there you go. Practically speaking, what does that mean? 90%.
They do everything.
Yeah.
It's something that I love doing, and I'm glad we get to do a lot here. Is interact with PAs that are practicing. Really get you out and experience and seeing what PAs can do. And I think it comes into more of a question of what can't PAs do, because they can do everything. You can see patients, diagnose, write scripts, and I don't think there's any limitations on medications anymore. I could be wrong, but I think PAs can write all medications that doctors can. They assist in surgery. They do pre-ops, post-ops, anything in medicine. Pretty much, I think a PA can do. short of like starting their own practice and kind of leading surgeries. But
some of this is dependent on which state you're practicing.
Yes. Yeah, that is true.
Very dependent.
Very state
dependent. Unlike for MDs, the definitions of what PAs can do in different states, they're not uniform. He had something else to say about that. I think it's this one.
Yes, there's lots of change that has occurred because I've been in it for 27 years. So there's been significant change and change clear back from when it was first created back in the 1960s. When I graduated, there were limits on what kinds of medications I could prescribe. That has changed. I can prescribe all medications now, except for Schedule 1, and most people don't want to prescribe Schedule 1 medications. There was states that didn't have practice laws for PAs, and now all 50 states have practice laws. There's some variation from state to state, but they all have practice laws. Some are more generous than other states, and so we're working to continue that expansion of abilities to meet patients so that they don't have to travel hours and hours to get to see a clinician, really to expand those opportunities for healthcare in settings that may not always have that ability to do that. So we're really seeing that kind of expansion and those kinds of changes over time.
So getting back to why PAs were created, what's the history there? Because I think that sort of plays into what Dr. Brenneman was saying.
To my knowledge, it was created to kind of help fill a gap after, I can't remember which.
Vietnam.
Fill a gap of a lack of physicians in the 60s. And it was used as a way to give people who had military medical experience to then become practicing providers back home.
Yeah, that was my dad's story. He was a medic in the Special Forces.
Ooh,
paratrooper.
Wow. Okay.
Ooh.
So when he got done, he was a respiratory therapist, and then one of a physician colleague was like, "You should look into this new thing." And so I think he was in the first class of PAs to graduate from Dartmouth, not from Duke, where I guess it started.
It did, yep.
But from Dartmouth in New Hampshire. And then he was among the first PA in Massachusetts to start a career in Massachusetts. So that's kind of cool. But yeah, that was the primary motivator, as far as I could tell, is this shortage of physicians. Still talking about that.
Yep.
Yeah.
So many years later.
And I think that's why I was so drawn to that profession too, because of its intention to really focus on closing those gaps in our healthcare system and serving as more of a generalist.
Yeah.
I think especially now, medicine is getting very, very specialized.
Yeah.
And where the gap for primary care especially is growing. And so PAs can serve as more of a generalist and a mid-level practitioner to help accommodate those issues. And so that 10% comes back to more of the specialized work that takes years and years in a fellowship to even accomplish.
Yeah. So like surgery.
Yep.
Yeah.
And I can speak a little bit more on the value of PAs in surgery, because I interacted with them a lot on med-surg. And I will say that it really ensures that the quality of their recovery is being analyzed thoroughly by this PA who, is assisting the surgeon obviously in surgery, but is completing the majority of the rounds while the surgeon is able to really properly prepare. And also, because of the pandemic and the stop of elective surgeries and things like that, we saw a huge influx after those were allowed to come back. So we're having to accommodate that. And these PAs are helping to, and NPs are helping to kind of make sure that we're still, analyzing each person and still analyzing, okay, they recovered well, or they're able to ambulate 24 hours after this, but maybe this didn't go well. Maybe this lab isn't working. Their neuro tests didn't come back quite as well. What can we do? And so that you have just more brains working to kind of solve these types of problems. And so it's not necessarily focusing on, okay, we're working for PAs to be more autonomous. We're just making sure that we're still ensuring the best quality of care and reaching more patients at the same time.
Which is something, just to comment on that, which is something I think that's cool about the PA program here, is that we get to learn with doctors.
Yeah.
I mean, we're doing everything that the med students are doing, which I think really kind of not only starts that collaboration that we see in hospitals, but it also shows that PAs can do what doctors do.
Yeah.
I mean, we all learn together. We learn the same stuff. And I think it kind of levels the playing field. So when these future providers that we're in med school with end up going out into the field and they see someone that's a PA, they know that they're competent. They have faith in what they're doing. And because it started here, it started with them learning, all of us together, which I think is pretty cool.
Yeah, let's underline that a little bit because, as you say, you guys learn together. And that's the first, so the MD program here has a preclinical component, which is 18 months.
Yes.
And you guys, at least for that first 18 months, are also doing the same exact classes, the same exact schedule. You're learning with them, you're integrated with them. It's a pretty unusual arrangement. I think it might be the only
arrangement. We're the only one.
That's what brought me here.
Yeah, most other PA schools are sort of separate from, I mean, they're probably associated with medical schools, but their education components are separate, which I think is pretty interesting.
It's cool. I mean, you get to interact with providers, or we're all future providers. We're all going to be doing the same thing. So it's cool kind of seeing the other side of the coin. I have some friends in just PA schools, and they're great schools. They were learning the same stuff, but the method at which we are taught things with the medical students, I feel like we hear a lot more of the whys.
Yeah.
Like, why does this disease state happen? And we get lectures from the embryologists that study that disease state, or we get lectures from a pathologist that looks at those cells, instead of having like a professor who has to be a generalist across the board, teach X, Y, and Z, all these subjects. We get the specialists that the med students would have also gotten.
We're incredibly fortunate to have that.
Oh yeah, very lucky to have that kind of stuff.
And I think there's something to be said about, just the difference between PA. The profession of a PA has been around since the 60s, which means the schools that are certifying us have only been around since the 60s, whereas the Carver College of Medicine has been around for a long time. And so to go to PA school and then, kind of like Noah was saying, have the resources of the Carver College of Medicine in addition to that, it kind of feels like you can't be set up for anything but success.
Yeah.
Like you have everything at your disposal. You have the tutor groups, you have every advantage that the medical students have is also afforded to you. It doesn't matter that you're a PA student or you're a med student. You're a first year Carver College of Medicine student.
Is PA a uniquely American thing?
It's not, actually. So there are other countries in Europe and other areas that utilize physician assistants, but their ability to prescribe and their scope of practice is widely different. I was looking into this the other day.
Yeah.
So the role and the kind of the span at which they can practice is widely different in other countries.
Do you remember which countries offer something analogous to the physician assistant?
So I think it was primarily European countries that I was looking into. I think Canada also has a few options in terms of programs, at least. But again, just like any other region or like state to state kind of thing, we're looking at a lot of discrepancy in terms of our ability to do certain aspects. So. Yeah.
So I was looking up the U.S. Bureau of Labor Statistics facts about the profession, and the PA profession is growing. It looks like. I mean, they predict a 27% growth in PA jobs from 2022 to 2032, much faster than average for all occupations. I guess that's a reflection of, America, the United States of America, and its aging population, a lack of access, as you've been talking about, in rural areas, and sort of a recognition that, this is a valuable tool in getting people the medical care that they need.
I think it speaks to the flexibility a PA has, because we can do everything, or pretty much 90% of everything a doctor can do. But I mean, if you have more people getting out of school faster, then you get more people entering the workforce, get more growth. So then we can go to those rural places. We can do those things.
Oh, I started to say when we were talking about the PA education versus the MD education, it's PA is here anyway, is a
2.5
year program.
Yeah.
So
28 months now.
Something like that. Yeah.
So you go through that 18 months of preclinical with the MD students, and then you guys kind of break off and do 10 months of clinical rotations. Yep. And are there specified rotations that you need to do?
Yeah. So correct me if I'm wrong, but I believe we have to do internal medicine, emergency medicine, psych, OBGYN, surgery, and pediatrics.
And I
thought there was family
there's
med,
like
too.
family
medicine. Okay, yeah.
Or like another like primary care focus.
Yep. And then we get to choose 2 specialties or like 2 rotations of our own. So if you really liked your internal medicine rotation, you could go back and do that again. Or if you didn't get to see a subspecialty that you want to go to, you could, try and do that.
But again, pretty general focus.
Yeah.
Yeah.
Generalist focus. Yeah.
So what would you guys pick for your rotations? What's on the list?
The extra 2.
Yeah. Oh yeah.
Ooh. I really, really, really enjoyed watching pediatric surgery, general surgery specifically, and just seeing the variety of procedures that were done. This was in Kenya, so it will look very different in the United States. And most people are like, oh my gosh, we're operating on kids. That's so scary. But just knowing how a surgery, and oftentimes like when they are done, and in the US, we're able to catch things a lot faster and have a lot more resources in that regards, can impact somebody for the rest of their life is just absolutely mind-boggling to me. And the detail in the surgery as well. Not that, adult surgeries aren't detailed, but, you're working on a significantly smaller person. And so you're just, it's beautiful. Surgery it's got a beauty to it. So. Yeah.
Similar lines, I guess. I really enjoyed my last year at my job. I was specifically in the pediatric cardiology department. So I think either adult or pediatric electrophysiology, which is like a subspecialty within.
That's pretty. So
Whoa,
interesting.
Say that one again.
but what's interesting is like the profession is focused on, sort of a generalist education.
Yeah.
But you can specialize.
Yeah.
And you can even subspecialize.
Well, that's one of the really enticing things about the profession. So for me, for example, I love the fact that I could start in something as specialized as pediatric electrophysiology, and then I can back off to pediatric cardiology if I want to, and then I could back off to general pediatrics, because as PAs we're allowed to switch the field that we work in, which
without jumping through the additional hoops that an MD would, like having to go back through residency and going back through even the match.
And so part of that, I think, is another thing I really like is I feel like you guys may agree too, is that I feel like as PAs, we allow doctors to do their job better and they allow us to do our job better. Specifically in the situation of when Emily was talking about how you have a PA that is going to be involved in a lot of like post-op, pre-op care for surgery. By our profession doing that, you're then allowing the surgeon to focus a little bit more intensely on the surgeries that they are doing.
Yeah, this is one reason I get a little riled up about the whole debate about mid-level creep. My position is that that's not a bad thing. It's a good thing, I think, because again, like you said, doctors aren't getting any less busy. They're getting more busy. And you guys are uniquely positioned to do the things that doctors are not able to do, just aren't able to fit in the time to do. Like, I think that's a beneficial thing.
Yeah. What about you, Olivia? Rotations?
I want to do an ortho rotation.
Ortho bro.
I could see it. I can see it.
My tiny but mighty.
I was going to say, like, it's time to. I mean, I don't know if you're buff or not. I'm not going to say on
Just flex the arm real
but
quick.
it's time to get real swole.
Yeah. So I've already mentioned on the previous episode I was on, I want to do like family medicine and be focused on like primary care. And a lot of family med clinics nowadays and even urgent care have x-rays and imaging that you can use. And so I feel like if I'm in that setting, I want to have a really strong ortho background to kind of supplement the care that I'm giving to patients. So that's why I want to do ortho. I also want to do cardiology as well, possibly. Just again, cardiology is the foundation to a lot of pathophysiology. And I want to make sure I have a good hands-on experience during clinicals to make sure I know everything as best as possible before I start practicing.
I've heard a few people look at that where this is a learning opportunity to set yourself up for success later on. Get extra practice for this, get extra practice with that. That's pretty cool.
Yeah. What about you, Noah?
I really don't know where I'm going, so I kind of like checking out a bunch of stuff. So the main goal for me is I'm a big fan of kind of like the rural side of medicine, really kind of making use of what you have, jack of all trades, master of none, stuff like that. And I've heard rumors that there is an international rotation. And
they're coming back.
I hope so. I don't care where it's going. Rumors. I don't care how to get there. Rumors. They're strong rumors. But I've heard some people go to Belize. I've heard India. And I feel like that would be an experience where not only are you, maybe you don't have all the toys and gizmos we have here in the States, let alone at a university hospital, but you are in a small village. You're helping people. Like you're seeing that instant gratification, and you get to look someone in the eye and say, I can help you, help them, and then see how it affects their life. You kind of get creative. It's not a bad thing, but I like that kind of creative problem solving, the solutions, and just really getting to know people on that level. Hopefully it happens. We'll see if it does, but that'd be pretty cool.
We got like a year and a half, 2 years almost until. So
we started talking about it in December, actually. So here we go.
That's terrifying.
That's what I said.
That's terrifying.
And I think
this happens pretty fast.
It sure does.
Going back to what you just said, I think it's really awesome that you want to do that too, because it would give you an exposure to a different culture.
Yep.
Yeah.
With different points of views and different like values within medicine itself. And I think that would also set you up very well for later in life if you ever encounter patients that come from different backgrounds, that you can apply your knowledge from that experience.
It'd be, I know it'd be difficult. You'd be seeing a completely different side of the world, different side. It wouldn't be like happy traveling. Hey, I'm gonna go to Italy for a week and kind of tourist. That's not what it would be. Like you're in the sticks, you're doing the stuff. Yeah. But I do think it would, upon completing that, if it happens, coming back to a university or a hospital or just a clinic with resources will not only like have me value that more, but know how to help people who may not have all of those toys.
Well, also, I mean, if your focus is on rural medicine, you have less resources.
Yeah. Oh, yeah. Where I was a phlebotomist most recently was at a big university hospital like here back in Colorado. And I think the furthest person I drew from, I think was South Dakota. I mean, they drove from this tiny town between South Dakota and Wyoming, I think. And I think they said it was 9-10 hours.
Yeah.
Drove to Colorado to receive treatment, and they were there for a week, every day, 10 hours getting testing. And it's...
Yeah, this is why we need more mid-level providers, more PAs, more MPs. Like this is the reason. People should not have to drive.
It was insane where people would come from. I communicate with people. They were we had a lot of transplant patients, and they would come from, I don't know how many people, listeners, I don't know if you guys have been to like mountainous Colorado, but you can go, I don't know, an hour or two without seeing any civilization. There are towns in, I'm sure like this is like this in Iowa, but there are towns in Colorado where you can hold your breath driving through them, and you have minutes to spare as you're holding your breath.
I can verify that.
Yeah.
And so I draw people where every day they drive 3 or 4 hours, come to clinic, get a blood draw, get a test done, and then leave, and then be back the next day and the next day. Because once that organ's there, you're in surgery a couple hours later. Like they need you there. So they were just waiting. And I mean, you can't always do transplants in the middle of, the mountains, but I think getting access or better access to providers and healthcare to people who they want to live where they want to live, but getting access there could probably help some of those people, because it's a long drive. It's some long drives that people are coming from.
I remember our similar story, our transplant unit at UW Health there was a patient who I think like took a puddle jumper overnight because he got the call and he was in like western or eastern Michigan, and he took like an overnight flight from like his friends who owned a plane and was a pilot, and like, but it's like getting the resources and access to that.
Oh yeah.
I want a puddle jumper.
Your friend who's got the puddle jumper that can just take you
Yeah.
But
it's so common.
That'd be the end goal, though. Well, in the other rotation, I figure it's an experience. Just see where they put me. I mean, you can learn something from everywhere. So
growth doesn't happen in the It's zone.
No, it does not. No, it does not.
As we're learning right now,
we are as far away from the comfort zone right now.
It's survivable. You can get through it, but it's a beast.
No, there's, before coming into PA school, working as a CNA for 3 years and kind of, seeing the patterns that I'm sure we all experienced as an EKG technician, as a phlebotomist, in our various roles that many of the other students have had as well. We really, I think, started to kind of, at least for me, I had this just drive, like, I want to learn. I want to learn more. And I need more to keep my brain going.
Yeah.
And so the greatest part about PA school and the most challenging aspect is it's fulfilling that want and that need to learn, and something that medicine will provide us for the rest of our careers.
We're never gonna be done.
We're never done. But like it's finally satisfying this curiosity that we all have, which is really, really cool.
At times it does though feel like, have you ever seen those videos like a python trying to eat an antelope or something like that? It's that, like, you're just trying to get it down, but there's always a little bit more. There's always a little bit more. You end up getting it down, but it's just like, wow, don't want to do that again.
I really hope that trends more than the fire hose analogy.
I was going to say, I'll use that this afternoon.
Oh yeah.
Or the pancake analogy.
Pancakes. That's probably better. That's probably better.
Instead of a python and an antelope.
But I'd have pancakes again. I wouldn't want an antelope again. No.
Right.
That's a good point.
Shortcoats, if you're enjoying our conversation today, I'd be grateful if you'd let people know by posting a story on Instagram or Facebook or tweeting about us. And don't forget to tag us in your post.
Thank you.
When you get out of PA school, what do you anticipate your debt load will be?
Money.
So I went to a private undergrad. I went to Luther College, so it was very expensive to go there. Huh? It's a great school. I miss Decorah. It's a lovely area.
It's a beautiful town.
So private undergrad school plus.
Let's skip private undergrad.
Yeah. And I didn't take a gap year, so I am still accumulating my debt right now. I didn't take any time off to work on paying that back. So let's see. I'm calculating internally right now. I think I'll be under 200 grand.
Okay.
I think I was very fortunate undergrad. For some reason, in-state schools in Colorado, they don't give out any scholarships, but schools out of state did, and they gave me a pretty nice one. So I was able to go through undergrad with very minimal loans, which was nice. But coming to here, this is my first interaction with loans, and they're terrifying. I'm not a fan, but I'll probably be sitting, I don't know, 150, something like that.
Yeah, I kind of similar story to Noah. My first university I attended in college was out of state, private, very expensive, but they did give good scholarships. I played a sport, so I was able to get a good scholarship there. I transferred back to in-state school, which was much, much, much cheaper. So I was very lucky, thanks to help from some family and a little bit of myself working. I made it out of undergrad debt-free. And then right now, I'm still very lucky to have some super supportive grandparents and parents, as well as an amazing wife who has taken on the burden of supporting me throughout the PA school journey. So
my wife also has, but
yeah, I don't anticipate she'll stop supporting me. But I think with combination from I didn't do anything during my 2 gap years other than work. So with combination of the money I saved up and hopefully some other stuff, I think I'll be out of here with like 20 to 30.
Nice.
In debt, hopefully.
Wow.
Nice.
Holy cow. Okay.
Wow. Yeah. So I started working at the state fair at 16 and then worked at the movie theater and saved money since then, and was fortunate to have had good job opportunities throughout college and got a lot of great scholarships for being in state. at Iowa State. Go Cyclones. Very.
Wow.
I know. I put it on the podcast.
It's all right. No, I'll bleep that out.
I put it on there. And so I thankfully got out of undergrad without any loans. And this first year, I'm kind of using some of the money that I saved since high school, throughout college, and throughout my gap year, working as a bartender, saving those tips up. So I will probably be sitting at close to 60 grand.
Nice.
So let's see. The average student debt for PAs is $112,500. And according to the lanterncredit.com, is PA school worth it in 2023?
Yeah, how much are our interests right now for loans? 8%.
8%. It's not a good year.
It's like one of them is 7.5, or like one of them's
7.05.
Yeah, it's like the one that you have a limit on is like 7.05, and then the one you don't have a limit on is 8.05.
But the good news is median pay for physician assistants in May of 2022 was $126,000.
Ooh,
it's a nice number.
Yeah, so, it is.
And that's going to vary pretty widely depending on where you end up practicing and in what kind of patient population, what kind of work setting, all that kind of stuff.
Definitely.
But
I'd say it's worth it.
It's not bad.
Yeah, I'd say it's worth it.
Yeah. How much is med school?
Let's go to that. Yeah.
I know.
I had a friend who, when I was at my ECG tech job, he was applying to med school at the same time I was applying to PA school, and he was a very organized type person. So he had a spreadsheet with every med school he applied to. He applied to 52. He's insane. And he had every school's debt calculated out to when he would finish residency. Wow. With his loans and everything, and most of it was $600,000 to like $900,000 of debt for when he would finish his residency.
That's another big barrier too of providers. Like you have to be at a certain level economically to even like get into undergrad. Sometimes scholarships, there's limited amounts, and it's a privilege just to have even being a potential part of this process.
This is one of the reasons why, this is one of the reasons why MD students are so anxious. I mean, No kidding. If you look at your MD colleagues and you're like, why are they so uptight? And this is the reason, because, I think the perception is if you make a mistake, you're still going to be, let's see, so $250,995 on average for medical school for total student loan debt for MD students.
Yeah. But just with PA school versus medical school, I think that's a big barrier is the price tag.
Yeah.
Because I mean, just applications alone, it was in like 3 or 4,000. I mean, that's insane. Mm-hmm. And it's like, so if you have someone who might not have the most kind of backing from family and friends, if you have someone that has to do all of that themselves, I mean, all these things feel so far out of reach. I paid for all of the applications myself, and I'll tell you that was a hit.
Yeah,
that was a lot.
Yeah,
and so it's a big thing. I think that was good with PAs. That worked out for me well. It's like, okay, this is something I want to do. This is something I can do, and this is something I can afford, which is really nice.
Yeah. I think an important thing for anyone that's listening that is pre-PA or pre-MD is to reframe the way that you think about debt. I know we just threw around like a bunch of scary numbers, and it seems like a lot.
Yeah.
You have to think about it as an investment in yourself.
Yeah.
Like not a single one of us here, I think, would trade for the world. Nope. You could give me more debt, and I would still do this. It's investing in yourself to make yourself better and to like become the person and provider that you want to be. And so that's another big thing about choosing your PA school is I was accepted to another PA school other than Iowa when I got into Iowa. And the reason I ended up choosing Iowa, a large majority, was proximity to home, but also the fact that this school was $70,000 less than the school that I was going to go to. Mm-hmm. And so recognizing that debt is going to be something that happens, but it's something that you're choosing to do to better yourself.
I may be wrong about this. PA schools are mostly private.
Mm-hmm.
Yeah,
a lot of them. Yeah.
Yeah. Okay. Mm-hmm. So private schools are usually more expensive.
Yeah, it was incredibly lucky to get into not only my dream school, but to have like been a resident in the same state as well.
Yeah.
So.
Oh yeah, I'm missing out on that, man. Holy cow!
Yeah,
we have hills in Iowa.
Are they hills?
I mean,
Council Bluffs.
It's
It's a little bluffy up there.
Mounds,
Midwest hills. Yeah, no
bumps.
I'll tell you, there's two things I'm still getting used to after moving here. One, there's not a giant rock face just in one direction I can stare at.
Okay.
I'm so directionally challenged already, and you take away the mountains, I have no idea what's going on.
There are a few,
and I have.
You start to learn to navigate by water towers.
Oh, I'm doing that. But the other is the humidity, man. Holy cow! I have had the chance to live in Australia for a few months. I've been to Belize. I've been to Indonesia, and I'll tell you, I have sweat more here than any of those places. And in Australia, I was in the jungle, and it's still here. I don't understand it, and I don't think I ever will. But it's been a change. Let me tell you.
Okay.
It's unique.
I guess I just like to ask, how has PA school been for you guys?
Mm-hmm.
For people who are listening, thinking about joining this crew, joining this calling.
What are we, about a month in?
Yeah.
They started August 14th was the first day of classes.
Okay. Feels like it's been 6 years though.
Yeah.
I've aged.
I found a gray hair the other day.
You know what that's
scary.
from?
I did too.
Yeah.
Fortunately.
Yeah.
How has PA school been? I don't know. I think I was a little bit anxious coming into it just because all you hear about is how hard it is. And oh my gosh, the drinking from the fire hose analogy, eating pancakes or an antelope, whatever you prefer. But I think you get a little bit scared and nervous coming into it thinking that, oh my gosh, how am I going to do this? It's going to be unbearable. I'm not going to have any time for anything else. And so far, I have found that specific narrative to not be as true as people were saying, but that's my personal experience. It's overwhelming for sure. There's days when you go into lecture and it's your sixth one of the day and you just have to turn your brain off. And I have to say, I'm just going to have to look at that later because I've hit my quota for the day. I'm capped out. I can't. But it's definitely manageable. You do have to be smart with your time. You obviously can't not study for, a week and then try and cram everything into the 3 nights before the exams. But
I tried that.
I think if you can stay disciplined and stay on top of your stuff, I think it also, a huge part of it depends on where you did your undergrad, what your background is. Because our first 6 weeks has been pretty heavy on background biology, biochemistry, foundations, anatomy, and so
foundations of cellular life. It's all biochemistry and
cell bio.
So if you haven't done that before or struggled with that in the past, it might be a little bit more challenging, but it's definitely doable. We have people in our class that haven't been in school for the last 6-7 years. It's their first time back in the classroom and they're doing well. So, yeah. What about you, Emily?
It was a rocky start, I will say. I had been out of school for a year and a half and, I've lived in Iowa most of my life, so it didn't feel like a complete change of environment, but I had some issues with moving and just a lot of things kind of happening all at once at the beginning of school. And, I think the drinking out of a fire hose analogy for me was a bit spot on a little bit, but the fire hose, it dissipated a little bit in the last few weeks. And I think it's just kind of reframing your mindset. And frankly, your brain just starts to work a little bit differently too, to kind of categorize things and to just be more efficient. And that's something, like I said, I was a bartender, so I didn't really have to actively think about cell junctions as I'm, pouring or giving somebody some French fries. So it's kind of reawakening those neural pathways to work again. And I cannot stress this enough. And my classmates and the faculty have been so supportive through that kind of bump in the road that I had at the beginning. And we really play off of each other's strengths, and we are making it through together as a team, not as individual students. Yeah,
you got 24 other people who are plus outside of the PA program, 150 med students, I think. So you have a bunch of people who are going through the same thing as you. And so I feel like we do a pretty good job as a class of leaning on each other when we need each other. And
you guys seem pretty tight.
Helping people
Yeah.
close.
Yeah.
Yeah.
So I like I said, can't. And something that the faculty said during orientation, and I was like, yeah, they say that, but like when teachers say, oh, you can reach out, they're like, please don't, I'm busy. The thing is that like they truly want you to succeed, and they say, the hardest thing that you had to do was get here. And, it is in part your job to, of course, manage your own success as you get through the program. But the faculty is so dedicated in trying to help you strategize to move forward in whatever capacity that looks like for you. So,
yeah.
Olivia?
So I did not take a gap year. I graduated undergrad in May. And before I graduated, my academic advisor sat me down and she's like, listen, this is going to be hard for you in the fall. During the summer, take time for yourself.
Absolutely.
Make sure you're in a really good mental and emotional space. Work on that as much as you can during the summer and make sure that you feel refreshed, but also prepared to start. And I'm so happy I took their advice because I feel like I stepped into the program and really focused on learning rather than getting above a 90% on an exam.
Mm-hmm.
Yeah.
And I think developing that mindset for me has really helped me, one, appreciate how much I'm learning and why it's so important to learn, and B, also make sure I'm taking time for myself and realize I'm going to keep learning and I'm not going to know everything perfectly, and that's okay. So
what did you do during the summer? Did you just lie on the couch? What did you?
No.
That's what I do to prepare myself mentally for anything.
I worked until the end of June, and then all of July, I read a lot, just nonfiction, and also, what's it called? There's a book I read about mindset. Oh, Atomic Habits. Definitely recommend Atomic Habits.
Oh, Atomic Habits.
Yeah, Atomic Habits.
I thought that was the name of an author. Atomic Habits. Atomic Habits.
I thought it sounded like a vegetable of some sort. I don't know. I was trying to figure that one out.
Yeah. So I did a lot of mental mindset focused stuff. I walked every day. I worked out every day. Learned how to cook, or learned that I need a food subscription to come to me once a week so I can make food.
Fair.
But really worked on making sure from all perspectives of my life, my relationships with my family and with my significant other were in good shape. Definitely had a conversation with them about this is how much work I'm going to be going through. And when I'm stressed, this is what I need from you. And also so just had those conversations with my loved ones as well to really make sure everyone knew what was going on. And I had as much confidence in myself that I can get this done. It's going to be hard, but I just have to persevere to get through it.
I love that. Yeah. I love that. We get questions from listeners sometimes. And by the way, if you have a question, you can send it to theshortcoats@gmail.com. You can call us 347-SHORT-CT. We'll answer your questions. One question that we get fairly regularly is, what should I do in the summer before my M1 year to prepare? And my answer is always, don't study.
Yeah. Biggest advice.
Don't study. You're going to be doing enough of that. They already think you're prepared. That's why you're in medical school. That's why you're in PA school. Just chill. But I like I like what you did because it sounds very intentional. Like you had, and the advice that you got from your advisor is very terrific. Very smart.
Figure out what makes you feel like a person.
And keep doing that
person
thing. And value that too.
There's going to be times in school where school can make you feel like you're not a person and you're just a thing that takes in this information and then spits it back out for an exam. So figuring out what makes you feel happy and makes you feel like a person and keeping that up when you're in school is a nice reminder of.
It's like the cup analogy. You can't pour from an empty cup.
Yeah.
You can't do well in PA school if your cup is empty to begin with or during it. You have to make sure that you're refilling that cup as much as possible.
Yeah. Community is huge again for that, and they push you to say, you know what, I think you've studied enough today, let's go.
Well, I don't really know to add to that. I mean, that was pretty comprehensive, but it's hard. Like, I'm not going to sugarcoat it. This is hard, and it's a lot.
And look, like there's a huge variation in what hard means for each individual student.
Oh yeah. I took 3 years off after graduating from like undergrad and stuff. So I was in the same boat. My brain has not functioned at this degree in a very, very long time. So coming in, it hurt some days. It hurt, but it's doable. It's not impossible. It's not at times it's paralyzing, but I think the hardest part was just getting to this. I mean, the application process in itself is difficult, but that's where they test if you want it. That's where they see, all right, who's going to, for lack of a better phrase, nut up or shut up. Like, you're going to do this, you're going to get here or not. Zombieland quote. But that's where you earn it. Once you're here, like you said, they have faith in you. They know you can do it. And it's just being able to get up in the morning, put shoes on, and get here and get to work. That's difficult some days. These are some days, harder some other days. But I mean, our class, I mean, we're all really tight. Community is awesome. Yeah. It is wonderful. Our faculty and staff are always so supportive and helpful. You need anything, all the doors are always open. Yeah. There is a shout out to Audra. She does have food to give out to us, which is just the highlight of my day.
And those really long lectures.
Yeah. Oh yeah.
Audra and I work together in the student affairs and curriculum office.
She's the absolute best.
We work hard. Audra works harder.
Yes, she does.
Yes.
But it's something you sign up for. We at the end of the day, we did ask for this. And I got to say, after those hard days, like 12, 13-hour days, studying class, all that kind of stuff, when I go to sleep, I look back and like I wouldn't want to be doing anything else. Like this is what I enjoy. This is it hurts. I was a goalie for a large portion of my life, so I'm fine getting beat up, hit with things. But at the end of the day, you still get back up. You still get ready for the next day because it's gonna keep coming, and you can't stop it. But
well, that's our show. Noah and Olivia, thanks for bringing the idea to me in the first place for the PA Week episode. Noah, thanks for helping to put together the show.
For sure.
I hope did you help to put together? I don't want to be.
She's the idea. It was her idea.
I just want to give credit where credit's due. I've been thinking of Noah as the producer since he's been coming to me with so thanks for producing the show, whoever did it. And Emily and other Noah, thank you for.
I'm the original.
That's fine.
You're only the first one I referenced. That's all that.
Fair enough. You've gotten all of the friendly Noah nicknames. I've been hit with some self-labeled.
Married Noah, tall Noah, the various options.
Thanks for being on the show with us.
Yeah, thank you for having us.
It's been really fun.
And what kind of low-level provider would I be if I didn't thank you, Shortcoats, for making us part of your week? If you're new and you like what you heard today, follow the show wherever fine podcasts are available, like Spotify, Apple Podcasts, Google Podcasts, and YouTube. The show is made possible by a generous donation by Carver College of Medicine student government and ongoing support from the Writing and Humanities program. Our music is by Dr. Vox and Catmosphere. I'm Dave Etler saying, don't let the bastards get you down. Talk to you in 1 week. Hi, Shortcoats. Look, life in medical education, life in America, life in the world is often difficult. And I often wish I could help. All I have is this podcast, but in my wildest dreams, you have the support you need to lead a life of your choosing. You deserve to be happy, healthy, and successful in whatever ways you define those words. So if you need support because you've experienced racism, discrimination, harassment, mental health crises, I want you to be able to get the help that you need. And so I'm going to put some links in the show notes to some resources that you can use. But the bottom line is that for what it's worth, I see you. I know you're out there. I wish I could do more. Maybe I can in ways that I don't understand yet or know about. But I see you, and I'm glad you're here, and other people are too. This Shortcode podcast is a proud member of the MedEd Media Network. Inspiration, information, and guidance on your journey to medical school and beyond at mededmedia.com.